Well, a very good morning to you. Welcome to another edition of the Healthy Way right here in Love 101 FM, the family station. Today we're continuing the conversation around childhood cancer. September is Childhood Cancer Awareness Month, and joining us today is Dr. Aileen Lue, pediatrician at the Bustamante Hospital for Children. How are you, Dr. Lue? Welcome.
Hi, thank you for having me this morning to speak on this topic. As we know that September is celebrated as Childhood Cancer Month. I'm
Yeah,
doing well, and how are you?
very well. Thanks for asking. Yes. So let's pick up. We had a chat with Dr. Burton last week, and so we're continuing today. So, what type of cancers do we, usually see in children?
Sure. So, I'd like to share some facts about cancer in childhood.
Hmm.
So, it is actually the leading cause of death in children under 15 years. They usually affect the age group 1 to 14 years of age. And worldwide, globally, we do see 400,000 children and adolescents between the age 0 to 90 being diagnosed with a cancer annually.
Hmm.
Locally in our country, we do get 50 to 60 cases of children who are being diagnosed with cancer annually.
Hmm.
The most common type of cancer that we see is leukemia. And leukemia is a type of cancer affecting the white cell count, where we do see a rise in the abnormal white cell count that comes from the bone marrow.
Hmm.
There are other cancers that we may see in children, including brain cancer or central nervous system tumors. There's also lymphomas, and lymphomas is a type of cancer that affects the lymph nodes, or
Hmm.
what other persons may know as wax and cannon.
Right.
There is also neuroblastoma, which is a tumor of the immature nerve cell. There is also kidney tumors, including what we call Wilms tumor, as well as bone tumors. So these are some of the most common cancers that we see in children. There are
Hmm.
many others that occur less commonly in this age group.
Mm. And in terms of signs and symptoms, what are we talking about? What are some signs and symptoms that children may experience with cancer?
Right. So some of the signs and symptoms that we may see in the pediatric population with cancer would include fever, and the fever tends to be persistent or prolonged, not going away with any treatments, including fever medication or
Mm.
even antibiotics that's prescribed by the doctors. They may also have decreased or loss of appetite. They may also have unexplained weight loss and sudden weight loss as well. Night sweats occurring as well as swellings to the body. So these swellings can occur in the neck, under the arm, or in the groin area. They may also have abdominal pain, a mastoid abdomen. The abdomen might look a little puffy, or the parent might feel something hard in the abdomen. Some
Mm.
children may have bony pain or joint pain. They can also have bleeding abnormalities such as
Mhm.
gum bleed, nosebleed, or even bruising to the skin.
Mm.
Those where their blood count is affected, they may look pale, they can be lethargic, or they can get tired easily. Child cancer is sometimes detected late, unfortunately, and this may be due to insufficient awareness of these warning signs I've mentioned before. I want to encourage parents to be vigilant about their child's health and any concerns that they may have. They should really seek a doctor's care immediately rather than observing TB symptoms to go away. Also, want to
Mhm.
encourage parents to keep up with their well visits with their doctor or the pediatrician, as sometimes cancers or tumors can be an incidental finding during these well visits. So
And so if it's diagnosed late, is that when you find out you have to rush the process?
So any patient, right? So any patient that has a possible diagnosis of cancer, we do want to make the diagnosis early, as identification of the cancer early would lead to more effective, would lead to early response to treatment, effective treatment, better outcome as well, less suffering and less intensive treatment versus if it's picked up late or in its advanced
Mhm.
stage of the cancer that may actually need more intensive treatment.
Mm.
So it's really good if we can pick it up early.
Right, and that's recommended.
Right,
Yeah,
correct.
right. And Dr. Lou, in terms of difficulty or how much of a challenge in managing children with cancer, what are we talking about?
Right. So in terms of treatment of these patients, um, so the treatment towards these patients is geared towards the type of cancer as well as the stage of cancer. And treatment may include chemotherapy. And chemotherapy is a type of drug used to kill the cancer cells. It can be given orally or through the vein. Some children may need radiation, and radiation is really high energy being emitted from a machine. Others may need surgery, surgery to diagnose the type of cancer or to remove the tumor before or during chemotherapy treatment. And a small proportion of children may need a bone marrow transplant. In terms of challenges, we do have chemotherapy and radiation and surgery locally. Unfortunately, we don't have bone marrow transplants available in the English-speaking Caribbean. So oftentimes we do have to refer those patients for overseas care. Management requires a multidisciplinary approach with a team. The team would include the pediatrician, the hematologist, oncologist, the surgeon. The dietitian is also important as we want to maximize our children's nutrition before as well as during treatment, especially those who have decreasing appetite or weight loss. We also have a psychologist, social worker, the physiotherapist, and pharmacist who are also a part of the team. Management is geared towards a holistic approach. Not only do we want to focus on their physical health, but also their emotional and psychosocial aspects of their health is also important. Cancer do affect children of all ages. The repeated hospitalization or the doctor's visits, the frequent investigations, the needle sticks, as well as effects of treatment. They do take a toll on the children. Some may develop adjustment disorder or depression, unfortunately. And for these patients, we do refer to the psychiatrist for further care.
Right.
So
and,
these patients are
right. And so the treatment is similar to the adults, right? So pretty much the same.
You're correct, Chevauni.
Right.
You're correct, yes.
Right. Yes, you were saying?
Right, so these children are truly heroes in their own battle with cancer. Not only do we focus on the child, we also focus on the family as well. Parents are affected emotionally, psychologically, financially, as well as the siblings. Seeing their brother or sister going to hospital frequently and ill is really not easy. So we definitely take management of these type of patients in a holistic approach.
Very well. Now, from your perspective, from your view, how is it that you manage children with cancer? What do you say to them? What do you say to the parent or the parents?
Right. So we do have family meetings disclosing the diagnosis to the parents. We do leave the disclosure of the diagnosis of the child for the parents to do. Sometimes when they're young, they're not going to understand. But of course, those who are older, we do encourage the parents to disclose the diagnosis because the younger ones aren't going to understand why they're in hospital or receiving treatment, but the older ones are definitely going to understand. They're definitely going to pick up what is going on with them. And it's best to always disclose the diagnosis with them to help better manage them in terms of their cancer, especially if they need psychological support or emotional support that we can definitely offer for these patients.
Wow. Dr. Lue, what in your final thoughts, what do you want to say to, parents going through a difficult time now with their child battling cancer? What do you want to say to them?
So my final words I want to leave, it's definitely not an easy diagnosis to take. It is definitely hard. It takes a toll, but we are here for you. In terms of treating the patients, in terms of any support, we are definitely here for the patients as well as the rest of the family in terms of managing these patients.
Very well. Can I thank you, Dr. Lue? Appreciate it.
Sure, no problem. And thank you for having me. It's a pleasure.
All the best. Keep safe. Keep up the good work.
Oh, thank you. And keep safe too.
I will. Thank you. Dr. Aileen Lue there, pediatrician at the Bustamante Hospital for Children. We're talking about childhood cancer this month. September is Childhood Cancer Awareness Month, and so we will keep the conversation going. Really nice. This is Love 101, and it is the family station. Come back tomorrow, now, the same time for another program in the series. Stay with us now.